Your Beat. I'm Marlene O'Donnell, and today I have the pleasure of having with me Krista Rainey. And Krista, you're the Director of Rehabilitation Services at the Mystic Healthcare and Rehabilitation Center.
I am.
Thank you for being here today.
Thanks for having me.
Can you tell us where you're located and briefly what kind of things that you offer?
Yes, we are located at 475 High Street. It's off the Allen Street exit in Mystic. We're a 100-bed long-term care skilled nursing facility. Mm-hmm. We offer nursing care, rehabilitation care, as well as a wonderful recreation department.
Great. Sounds like fun.
It is.
So what part of the communities do you serve?
We serve New London County.
Mm-hmm.
We go as far as Westerly, Rhode Island, Norwich.
Wonderful. So you don't always have to be a resident of Mystic.
Oh no.
To take advantage of your
No, not at all.
facility.
All the surrounding towns.
Wonderful. And do you work with any hospitals? Like, can they refer some of their patients to you? Or?
Yep, we will receive our patients from Lawrence Memorial Hospital, Bacchus in Norwich, Westerly Hospital, as far as Hartford Hospital, St. Francis,
Wow.
even Yale.
Wow. So that's wonderful.
Yes.
Even though you're here. And it's a nice little facility where you're located.
Yes, very nice.
Do you offer outpatient services as
We
well?
do. Yep, we do. We have outpatient services. Actually, you can come in from the community, but
Mm-hmm.
a lot of our rehab patients that were there for inpatient services actually will come back some of the times. Like if they've had a knee replacement or
Mm-hmm.
a hip replacement,
Mm-hmm.
they might come back for a follow-up outpatient at Mystic Healthcare.
Wonderful. And there are some positive changes going on over at your facility.
Yes.
I think, as you mentioned, one of them has to be the recreation center.
Yes, yeah, and
Tell us about
renovations.
those.
Actually, we're in phase 2, and actually the rehab department is next.
Really?
So that's very exciting.
I'm sure.
Yes.
So is the recreation facility has already been?
No, just the lobby.
Okay.
Well, the lobby has been done. We have a brand new dining room. So that was phase 1.
Mm-hmm.
So phase 2 will actually be the rehab department, where they're expanding it quite a bit. So we'll be getting, we have a lot of equipment in our gym already, but we'll be getting more as far as when that's done. Yes.
Oh, I bet you are very excited about that. The therapists,
Yes.
getting their hands on new equipment and
Yep.
being able
Always
to do more.
exciting.
I'm sure. So, health and wellness philosophy. Do you have one at Mystic Healthcare?
We do. We have a health and wellness for our patients as well as our employees. Mm-hmm. So what happens when somebody comes in as a patient, they get a complimentary massage or Reiki treatment. It's their choice. So every person that comes in the rehab wing will get that choice. And also our long-term care residents also get a Reiki treatment on a quarterly basis.
Very nice.
Yep, that's worked into our recreation department.
Okay.
As well as the recreation department does yoga with our long-term care patients too.
Really?
Yes.
And how do they respond to that? Just out of curiosity, how do the patients respond to the yoga and because I know it's been a way for the younger generation.
Yes.
You know, how does that, because I think people think yoga and you're doing all these,
Right.
crazy
And I should be
positions and-
specific in saying chair yoga. And we
Okay.
do a lot of breathing techniques, a lot of meditation, a lot of relaxation. And we also offer yoga to our employees on a weekly basis, and that's complimentary for them as well.
That's very nice.
Yes.
So then they can kind of
Yeah.
be in tune with, be on the same page kind of as the residents that are there.
Yes.
So,
And our residents really, really look forward to the
I bet.
massages and
I bet. Tell us
treatments.
a little bit about Reiki real quick for those people who might not be familiar
Reiki
with
is a
Reiki.
hands-off energy treatment.
Okay.
Yep, it's light touch above the body part, and it's just a positive energy treatment.
Wonderful. And the programs. Let's talk about some of the programs other than the yoga and the Reiki. What else do you provide that goes along with your wellness philosophy?
We actually have a doctor, I want to talk about Dr. Peters, and he is a physiatrist. And he's a doctor who specializes in rehab. And he is based out of Lawrence Memorial, but comes to Mystic Healthcare on a weekly basis and sees all of our rehab, or I shouldn't say sees all of them, but if we're kind of, as a team, as a rehab team, stuck, or we need some, different input, Dr. Peters will give us that input.
Wonderful.
Yeah, so we can really get, think outside the box, and he brings that piece of whether it's a medication change, whether it is a different technique that we're not doing in rehab. So that's a really wonderful program.
That is.
Yes.
And you said he comes on a weekly basis?
He comes every week.
And do you pick what patients he sees, or does he do this for the therapist as well?
We get together as a group.
Okay.
We have a meeting on a weekly basis, and knowing that he's coming in, on Monday, we'll get together as a team: physical therapy, occupational therapy, as well as speech therapy, and talk about the deficits, or just things that we're running into that we can't seem to solve. And he gives us really wonderful input.
That's wonderful.
It is.
Like you said, just to bounce it off.
Yep,
different
set of ears.
Yeah.
Yep.
Wonderful. The average length of stay for a rehabilitating patient, is there one? Or
it varies. With our orthopedic patients, maybe our hip replacements or our knee replacements, depending on how the surgery went, how they're tolerating their pain. It could be as less as 10 to 12 days. If we've got somebody with more deficits, like somebody that's maybe had a CVA, which is a stroke, it could be anywhere from 30 to 60 days, with our goal obviously trying to get them home. That's our goal.
And I think you may have touched on this before, but I'm going to ask you again anyway. When they go home, if they need more, can they come back?
Yep. Typically how it works, if somebody goes home after receiving therapy, for whatever amount of time that they were there, they most likely will go home with home services. But after those end, they can always return for the outpatient service. Which on an outpatient basis, we have physical therapy, occupational therapy, and speech therapy.
Wow.
And we actually offer our inpatients 7-day-a-week coverage if needed.
That's wonderful.
Yes, it is wonderful.
Especially if they're out with caregivers and
Yep.
they need that on the weekend, which is very nice.
Yep.
Because everything happens on the weekend.
Of course.
So.
Yep.
That's wonderful.
Yeah, there's always an OT and PT in the building on the weekends.
And when you said home visits, does that mean that you have therapists that actually go to the home?
Upon discharge, when somebody's getting ready to go home after their new onset of whatever may have happened to them, their environment might need some changes. They might need grab bars, they might need a ramp versus the stairs if they're unable to do the stairs. So physical therapy and occupational therapy will actually go out to the home with the patient and make all of those recommendations. So we'll actually see the patient, attempting to get into the house or the bathroom or the kitchen, and then make recommendations so they can go back to their prior level of function.
Very comforting.
Yes.
For someone who is, probably they come home and they're nervous.
Yep.
I'm sure.
And the family member as well.
Right.
Yes.
So that's very comforting that they have knowledge from the therapist on what to do instead of trying to guess of what it is they could do.
Yes.
Because I think maybe sometimes the caregivers and the patients kind of don't see eye to eye, but if you have that mediator there, which is you.
Yes.
They both heard what you said.
Great point.
Right.
Yes, it takes a lot off
very
of
comforting.
the care. Yep.
Definitely. So what are the types of diagnosis that you work with?
Oh gosh, anywhere from we work with total knee replacements, total hip replacements, any sort of surgical patients, COPD,
That's a big one.
CVAs.
Which is?
That's a stroke.
Okay.
Yep.
Wow.
Yep, so we really hit a multitude of different diagnoses. And also I would like to speak about, we offer modalities at Mystic Healthcare.
Which is?
Diathermy and electrical stimulation and ultrasound.
Really?
Yes, yep. That's actually, we lease it, so it's always in our building. So they're used for pain or for contractures, for swelling, for edema. So, yep, great stuff.
You have great stuff there. And hopefully after this, people will know more about the Mystic Healthcare.
Yes, hopefully.
Because I know you're, like I said, it's a beautiful area where you are, but you're kind of hidden back there.
Yes.
And I know you've had a name change.
Yes.
So for those who may not know, you are the old Mystic Manor.
Yes.
Well, you used to be called Mystic Manor. I should probably specify that. Now
Now
the
we're
name has changed.
actually Mystic Healthcare and Rehabilitation.
With wonderful services.
Great services.
So do you provide healthcare education to the community? Because there's a lot, I mean, obviously you have wonderful programs for helping the patients. And well, we touched a little bit on, going to the home after discharge. But do you kind of get out in the community to do a little bit of outreach?
We do, and we're actually trying to get people to come into our community.
Okay.
And Dr. Gaudio, who's a cardiologist at L&M, he was just at our facility last week, giving a
Wonderful.
free lecture, on cardiac health and issues. And we actually have a Dr. Pagula, if I'm pronouncing that correctly, out of Guilford, and he's the Institute of Vision. And he's actually coming next week. And it's all free. They're, free to the community, education.
So do you have, and that's open not only to the patients, but open to the caregivers and
To the community.
To the community?
Yep.
Okay. So even if I didn't have anybody, I didn't have a loved one at your facility, but I have a loved one that I'm concerned about, I could just come to your...
Absolutely.
Okay. And do you have to sign
Absolutely.
up, or do you like people to call? And
Yeah,
let
we
you know?
like people to call, but you can come regardless if you call or not.
Okay. And is there information, like, do you have a website?
We
or
do.
You do?
We do have a website.
Okay.
Yep.
Wonderful. So we'll provide that with them for them later. We'll get that
Wonderful.
from you.
Good.
Do you provide the same services to your long care patients as you do your short care patients?
We do. Of course, I'm from
short-term?
rehab.
course.
Yes, but we definitely provide the same services to our long-term care patients. I'm going to focus on the team at Mystic Healthcare. I'm new to Mystic this past February, not new to the company, but new to the building.
Okay.
And we've got a new director of nurses and a new AD&S, and I'm new to rehab. So, and we really look at things from a team approach.
That's wonderful.
Especially our long-term care patients. So we screen our long-term care patients quarterly. So if there's been any sort of decline in function, rehab is the first person there trying to get that person back to where they were. Whether it
That's
be
great.
walking or whether it be seating or positioning in bed, we touch upon all those things, and we really try to stay on top of that. So nobody, people are going to decline, but we really want to try to give the best care we can in order for them to
Right.
be safe.
Well, and stay consistent with their functioning,
Yes.
their level of functioning. So when you do that, if you said it's quarterly, correct? But if you see somebody, would it be possible, because you have such a big facility, is it possible for you to see a decline sooner than that?
Yes.
So you would be aware of that?
Yep, and we have a meeting. We have morning meetings. And if somebody has a decline, I will hear about it, from nursing. And then the therapist will go in and do a screen and make their assessments from there.
So you always, it sounds like you have a wonderful chain of communication
Absolutely.
there.
Yep.
And it's nice that you said the director of nursing
Yes.
is new.
She's new.
And you're fairly new, not to the company, but to the facility.
Yes.
So that's kind of exciting for the
It's
patients
very
that are there.
exciting.
New set of eyes, a new set of ideas.
Yep.
And the expansion sounds wonderful.
Yes, it's beautiful.
So that's exciting.
Yes.
So let's go back to like the yoga and the Reiki. The yoga, you said, is chair yoga.
It is for the...
And you teach that.
Yes.
Okay.
Yep, I am a new yoga teacher.
Wonderful.
Yep. So the yoga for the residents,
Mm-hmm.
our long-term care residents, I should specify, would be chair yoga.
Okay.
We do yoga with some of our rehab patients.
Okay.
And then we, of course, offer it to our employees,
Which is nice.
which is not chair yoga.
Yeah. Yeah, they probably sometimes at the end of the day wish it was chair yoga. I'm
Yeah,
sure if they're
exactly.
saying, Krista, give me a chair. But
And we've actually opened up that yoga. It's actually every Thursday at 3 o'clock to the community and to all the
Really?
family members.
no way.
Yep.
So like anybody in the community,
Anybody
I
in
could
the
come walking down the
community
hill and
yep,
say,
can come in and
hi
do
Krista, I need yoga today.
That's right. Yep.
Oh, that's wonderful.
Yep.
Wonderful. So yes, I will have to get your website. We can post your website there.
Oh, good.
Is there anything you want to leave our audience with that maybe we didn't touch on, or that maybe you think is very important for them to know or learn about Mystic Healthcare?
Well, I think that coming in to see our facility I would highly recommend that. Coming
Sounds
in.
like you're very welcoming of that too.
Oh gosh,
for
yes,
everybody to
anytime. Yep, you can just show up, you can call, just checking out all of our new renovations. It's really, really a quite beautiful facility. You can come in to observe therapy at any point. Just, come in and take a tour and get a feel for the building. We have a lot to offer.
And now, do you have to call for a tour?
You can show up or you
Okay.
can call.
Okay.
Yep, you can call and ask for our admissions person.
And is the best time to come Monday through Friday?
I
for a
would say
tour?
so. Yep, but you can come on weekends too.
You probably have shorter staff.
Yes,
On
there's
the
less
weekends.
staff, but there are supervisors there
And
therapists.
they would be familiar.
Yes.
Of course, you have to have the therapist
That's
there.
right.
What would we do without the yoga and the Reiki? And
That's
the,
right.
And so when they come into rehab, mentally, I'm sure you have to be on top of it. Rehabilitation-wise. I mean, it's not only the physical, but I'm sure they come in with a little mental
Absolutely. There's a lot going on.
depression or,
Yep.
I mean, I'm not trying to diagnose anybody, but, it's they're,
The patient
low.
has been through a lot.
Yes.
Yes, physically,
Especially the
mentally,
older.
emotionally. Yes, especially the older person. So it really is, giving that individual one-on-one treatment and really making sure the plan of care is appropriate for them.
which is wonderful.
Yes.
And it's nice for the family to go in knowing that you know all that. That they're not only there for physical strength, but they're also there for mental strength.
Absolutely.
So.
And I'm always
that's comforting.
accessible as the manager of the rehab department. I
Which is
mean, whether they have, concerns or problems about their loved one.
Right.
I can always be reached.
I'm gonna call you right after this.
All right.
Set up an appointment with you. So thank you so much for being here.
You're welcome.
It was a pleasure.
Thank you.
Thank you for all the knowledge. And please visit Mystic Healthcare and Rehabilitation Center. It sounds like a wonderful place offering a number of wonderful things.
Yes.
And you are trying to reach out to the community. So
Yep.
come out and see Krista at the healthcare, and I will make sure we get your website up too.
Thank you.
Thank you so much. And thank you for joining us at Senior Beat. We'll see you next time.